Hello. Welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about try 6 easy antidotes for the pain epidemic from sitting. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Even if you have back pain once, you know how problematic it is. The structure of the spine in the lower part is naturally curved inwards, and when sitting, the curvature of the back is directed outwards and the lumbar position deviates from its normal position and eventually leads to low back pain. Probably one of the main causes of low back pain is related to prolonged sitting, followed by increased pressure on the back, neck, arms, and legs, as well as the muscles of the back and disc. In today's video, we are going to be sharing with you 6 easy ways to relieve the pain from sitting. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. It should be noted that many people also suffer from low back pain while sleeping, especially if their sleeping position is such that the lower back arch is inclined outwards. Home remedies for lower back pain. Despite the improvement in sitting posture, we recommend that patients try this type of home remedy for low back pain as well. Over-the-counter medication can relieve discomfort and swell with painkillers such as nonsteroidal anti-inflammatory drugs. Using a backrest. If you sometimes forget to sit in the correct position, you can prepare a rolled towel or a pillow for the waist, and when sitting on it, massage it. Yoga. The sport of yoga is known for its 2 properties of stretching and strengthening the muscles of the body. Dynamic sitting is generally considered an abnormal posture for the body, but if your job forces you to sit for a long time, it is better to stay active. Change your position. Provide a standing table and chair. These types of chairs are ergonomic and help maintain the correct body position and sometimes the height of the monitor. Ice therapy. Ice has anti-inflammatory properties. Apply an ice pack to the affected area for 20 minutes and then remove. If possible, perform this technique every 4 hours. Using a heating pad. After the inflammation has been controlled, approximately within 24 hours, many patients find the use of a heating pad soothing. These heat pads accelerate the healing process by increasing blood circulation in the lumbar region. Use of ergonomic equipment in the office. If you want to reduce the pressure on the neck while working, it is necessary to equip the work environment with comfortable and ergonomic facilities and equipment. Be sure to place the desk in a position where the elbows are on the table horizontally and completely open. Your desk needs to be equipped with support for the lower back, but be sure to use an adjustable table so that you can give a 90-degree angle to the legs and at the same time the soles of the feet are flat on the floor. You can try these stretches and exercises to reduce your back pain from sitting. Number 6. Plank. Get into a swimming position with your forearms in contact with the ground. Try to keep your elbows in line with the tops of your shoulders. Now, with the help of your forearms and toes, bring your body up, keep your back completely straight, and place your elbows on the floor. Stay in this position for a few seconds and then return the body to the first point. Number 5. Dog bird. With your back straight, place your hands and knees on the floor. Extend one leg from behind and extend the opposite arm straight forward. Hold this position for 5 seconds and then return to the first point. Perform the movement on the other hand and knee. Number 4. Standing hamstring stretches. In these exercises, squeezing the mandibular muscle with pressure is used to strengthen the mandibular muscle for 30 to 50 seconds at a time. The patient needs to do this exercise once or twice a day as a passive exercise with limited pressure on the muscles. This exercise is one of the most common healing techniques for this problem. For this purpose, it is necessary to be in a standing position and gently bend forward from the waist area. In this position, the arms are hanging on either side of the body and the legs will be straight. Then try to put your hands on your toes, but do not push yourself too hard to do so. Stop doing this when you feel too much pressure on your Achilles. Number 3. Squeezing while sitting on a chair. If sitting on a chair is used to stretch the sphincter muscle, less pressure will be applied to the back. For this purpose, it is necessary to sit on a chair and place your legs in a stretched position in front of you on another chair. In this situation, try to put your hand on your toes. Use one foot at a time to perform this exercise. Number 2. Pelvic tilt. This movement is an active exercise that focuses on the abdominal muscles, and these muscles are used to move the spine. For this, you need to lie on the ground and bend your knees. Tighten your abdominal muscles and press your lower back to the ground. Move the lifting of the limbs. This exercise is a more active movement compared to pelvic tilt, in which the movement of the arms or legs is used to move the spine. In fact, this exercise can be considered as a movement to open the pelvic joint. To do this, lie on one side and place one hand under your head. In this case, the other hand should be in a free position with the floor on the floor and near the chest. Bend both knees and bend the pelvic joint so that you have a comfortable position to position your spine. Gently lift the right foot 8 to 10 inches off the ground. Repeat this movement 5 to 10 times and then do it with the other side. Number 1. Bridge with the ball. It is an advanced exercise for stabilizing the spine that causes unpredictable movements, and the body must respond appropriately to these movements created as a result of using the ball. To do this, lie on the floor and place both of your tees on a ball. In this case, the hands should be free on both sides of the body. Find the right position for the spine and maintain this position while slightly tightening the abdominal muscles to lift the buttocks 2 to 3 inches off the ground. The items we mentioned in this video are home remedies. If you feel your pain is serious and won't heal by these remedies, see a doctor as soon as possible to prevent further damages. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.